I am Dr. Eric Jones, and I am a pediatric hospitalist. In order to be a pediatric hospitalist, somebody needs to complete their undergraduate training, then they need to complete medical school, which is 4 years, and then they receive 3 years of training in general pediatrics. A pediatric hospitalist's responsibilities in the hospital, they start at newborn and go all the way to when a patient is 18 years old. At newborn, we're doing exams on all of the newborns, looking for any sort of birth defects or health problems that they might have and making sure the babies are healthy. And also offering counseling and advice to parents and answering any questions that they have about their new babies. Then also on the other end of the spectrum from newborn babies, we're also taking care of babies that have deliveries that don't go well. And so we're there in case the babies need breathing tubes and in case they need respiratory support or chest tubes. So we're taking care of that. And then when children get a little older, we admit them to the hospital. So if they are dehydrated and they need IV fluids, or if they need breathing treatments, if they have asthma and they're not able to manage it at home, then we'll take care of them. And then as patients get older, especially like in the mental health field, we will take care of patients from a physical standpoint while they're in the hospital, while they're receiving mental health treatment. So the partnership between Genesis Hospital and Nationwide Children's Hospital is really going to benefit the community because it allows pediatric hospitalists to be in the hospital 24/7. And what that means is on the mother-baby unit, when there is a delivery that doesn't go well and baby needs help, the nurses can get a hold of me or whatever pediatric hospitalist is there. And we'll be immediately available to go straight to that patient's room and provide care right away when they need it. We'll also be available to assist the emergency room doctors. So if they have a child come in and they would like advice on how to manage that child, whether they need to be transported to Nationwide Children's or maybe they're safe to stay here, then I'm able to go and offer my advice to the emergency room doctor and work in tandem with them to really provide the best care for that patient and you know, if possible at all, keeping them close to home in Zanesville. At Genesis Hospital, the pediatric hospitalist will be involved in a few different areas. So I would say where we'll spend most of our time is going to be on labor and delivery in the mother-baby unit, taking care of infants. We'll also be available to the emergency room doctors as consultants and to offer advice and assistance whenever they need that. We will also be admitting patients to the floor, and so we will be taking care of children just on the regular pediatric floor. So a pediatric hospitalist is available in the hospital to treat children from newborn all the way to 18 years old. And we really provide the specialty in children. So there's a saying in pediatrics that children are not just small adults. And so they require their own specialized and individualized treatments. So we take care of well newborns and well infants. We take care of children that are dehydrated and need fluids, children that need extra breathing support, and then we take care of adolescents and the problems that teenagers have. And I think what we bring to the table is just knowing the differences and how do you treat a 2-year-old child different than an 8-year-old child, different than a 16-year-old adolescent. And so we're available to the emergency room to answer their questions. And then also when the patients are in the hospital, we're there 24/7. The nurses can get a hold of us and parents can talk to us whenever they need. And so we're able to just offer that support. So a typical day for me as a pediatric hospitalist is going to start in the well baby nursery. I'm going to start by taking care of all of the babies that need to go home. We'll be doing any circumcisions that need to be done and answering any final questions that the parents have before they take their babies home. Then usually I'll move over to the special care nursery. And so we take care of children all the way down to 32 weeks at Genesis, which is something that I think maybe not everybody knows. And that's a great resource to have. So if a baby's born prematurely and we can keep that baby at the hospital, then we try to do that so that parents can be close to their babies. So then I'll take care of the baby in the baby's in the special care nursery. At any point, the emergency room might call for consultation, and so I can answer their questions, go down to the emergency department if needed. And also at any point in time, mothers are delivering babies, and if there are any deliveries that they need extra assistance in, then I would go and offer my help to the nurses there. And then after that, then I would probably go and round on all of the older children that are admitted to the pediatric floor. So as a pediatric hospitalist, I really want to take care of the child in conjunction with their own pediatrician. So the pediatric hospitalist is not trying to take over care or replace the community pediatrician. A pediatric hospitalist is there to take care of the child while they're in the hospital. And so with newborns, I'm going to be doing the initial exam of the baby and writing up a summary of all of my findings, and then I'll send that to their pediatrician, who will read that and then understand what's already been done for that child and what might need to be done in the future. For a child that is admitted to the hospital, the community pediatrician can call me directly and tell me what's going on with the child that they think needs to be admitted, and then I can accept that child and take care of them while they're in the hospital. And when I'm finished, then I'll write up a summary of all the things that I did for that patient and send it back to their community pediatrician so that they can see them and continue to receive the care that they need in the community. So the partnership between Genesis Hospital and Nationwide Children's Hospital is going to open up a lot of opportunities that I'm really excited about. So for example, there's a technology at Nationwide Children's Hospital called high-flow nasal cannula that we use pretty often to treat children. And that particular technology isn't available right now, but we're hoping that with some of the training and specialists that we have at Nationwide Children, that we can make that available here in the community so that those children can be treated closer to home.